All right, we're moving on down the skeletal system, and now we are on to the appendages of the pelvic girdle. So your leg bones are similar to your arm bones in that the more proximal one, you just have one, and your thigh bones are called your femurs over on the left and your right. And then down in the lower leg, just like you have in your forearm, you have two bones. And so the more medial ones, the bigger ones, are called the tibias, and then you've got the skinny ones that are over on the lateral side, and those are called the fibulas. And try not to make the error of calling the tibia the tibula or the fibula the fibia. So unfortunately their names are pretty close, and it's easy to do that. So practice with it and try not to do that on the anatomy test. All right, so let's take a look at let's do the right femur over here, and we'll take a look at its features. So the femur, of course, at the proximal end forms a ball and socket joint with the os coxa up there. And down here at the distal end, it is forming a joint with the tibia. So you have a pretty complex joint there as well. That's your knee joint. That's a hinge type joint, kind of like you have at your elbow. Okay, let's see. Let me deselect that. Move this down. Go forward. Okay, so your femur and your os coxa up here are wrapped up in lots of ligaments to help hold the ball of the femur in place. And as we saw before, the ball or the head of the femur fits inside the acetabulum on the os coxa. So you can see what that looks like there. And let's see, let me isolate the femur. Oops. All right, get rid of those, hide. Okay, so we're looking at the proximal end of the femur. I'm going to rotate this femur around, and do you see how there's an indentation right in there on the head of the femur, the ball? That is called the fovea capitis. That little indentation is a location where there's a ligament attached there that then extends into the acetabulum and helps anchor the ball of the femur in place. All right, and the other thing I want you guys to notice, if you go over, you're looking at the ball of the femur and you go in a lateral direction, you've got this, we're looking down from a superior vantage point here, looking down from the top. You've got this very pronounced process that's over on the lateral side. It's also, I'm rotating this around, and the head of the femur is anterior, and this would be the posterior portion. This is called your greater trochanter. It's a very pronounced process on this bone, and your gluteus maximus muscle is attached to that and pulls on that, your butt muscle, which you use when you are going to extend your legs. And with all that pulling on that part of the femur, that's what causes that greater trochanter to develop. Okay, and then if we rotate this around, and notice there's another little bump that is on the same side as the head of the femur. Okay, that's called the lesser trochanter. So it's on the medial side. The greater trochanter is over here on the lateral side. Okay. All right, so then you've got the shaft of the femur, and if we keep moving down the femur, just like you had in the humerus, you know how where the humerus flares out down here at the distal end, it gets wider. You have a medial and a lateral epicondyle. And the epicondyle, epi means over, so these are over the condyles. So where are the condyles of the femur? Let's rotate this around. Now you can really see them. You've got very obvious rocker-shaped feature right there and right there. All right, and so that's your medial one, and this is your lateral one over here on the lateral side. If we flip that around, that's really the most obvious. Those are the most obvious rocker-shaped features in the whole skeletal system. Okay, so those are actually all of the features of the femur. that you need to know. Let me bring the rest of the skeleton back up here for a minute so we can zoom in on the knee joint again and take a look at how all these bones articulate with each other. Oh, incidentally, how would you know left or right on a femur if you were looking at it? So if you just saw the femur off by itself, the anterior side is not quite as, let me hide that. The anterior side is not quite as impressive in terms of those condyles, those rockers, as the posterior side. So if you're obviously seeing the condyles, you're looking at the posterior side of the femur. That's one thing you need to know to orient yourself. And then once you know which side is anterior versus posterior, look up here. The ball is always going to be pointed in a medial direction. The greater trochanter over here is always going to be lateral. So those are clues that you need to use to help you figure out whether you're looking at a left or a right femur. All right, your knee joint is pretty complicated. We'll actually talk a little bit more about the knee joint over on the physiology functional side of things. You've got a lot of ligaments around the joint that help hold those two bones together. So this bone is, of course, the tibia. That's the bigger of the two lower leg bones. And let's, well, I'm going to leave the other bones in place for a minute. Let me get rid of that ligament and get rid of the ligament over here. Okay. Can you kind of see how you've got a curved feature on the lateral side? We rotate this around. You've got a curved feature over on the medial side. And even those, they're curved features, they have a curve, so they're also called condyles because they look like rockers, even though they're not really fitting into a depression anywhere that they're going to rock into. But nevertheless, because they have that curved shape, they are called condyles. So this is the lateral condyle, and then over on the medial side, you'll have the medial condyle of the tibia. All right. And let me get rid of the femur for a minute, and now you can see, there we go. See how you've got a very C-shaped shape on each side. Medial condyle, lateral condyle. And incidentally, that piece of connective tissue there and the one over there, each of those is a meniscus. Maybe you've heard of the meniscus padding that exists at the knee joint. And again, we'll talk more about that when we get to the physiology part of the unit. Okay, so just below the lateral and medial condyles of the tibia, you've got this very pronounced bump right there on each tibia. You've got it over here as well, but there's a ligament attached to it, and that is called your tibial tuberosity. So you have a radial tuberosity on the radius. You've got an ischial tuberosity on each of your ischiums, and you've got a tibial tuberosity on each tibia. That winds up being the attachment point for your quadriceps muscles, which we'll talk about when we do Unit 4, and that's the point just below your knee joint that they pull on so that you can extend your lower leg. So we'll be hearing about that again. Okay, the last feature, the medial malleolus, or some people say malleolus. So down here at the distal end of the tibia, you got a bunch of ligaments down in here. Let's hide those. Okay. So down here at the distal end, the tibia is articulating. You've got an articulation point where the tibia and the fibula over here where they come together. And then also the tibia is sitting up here on top of the talus, which is one of your ankle bones. Okay. That's the distal end, and then notice that the tibia has this little curved feature right here. All of that is called the medial malleolus or medial malleolus. So on the medial side, the inside of your leg, that little projection that you can feel down near your ankle where it's sticking out like that, that's what you're feeling. That's the medial malleolus. All right, and then how about the fibula? Go back up to the top. The fibula on each side, just these little thinner bones on the lateral side. And the only feature you actually have to know on the fibula is down here at the ankle, where the fibula gets wider, right down in here. That's called your lateral malleolus, down there at the ankle. So you have a lateral, and you know that. That's very pronounced over on the lateral side of your ankle as well, just like the medial malleolus over here is over on the medial side. Okay, that's actually all you need to know for the fibula. So I'll cut this particular video off here, and then the last video for the skeletal anatomy we'll talk about the ankle bones and then also the bones of your feet, which are named in a very similar way to the bones of your hand. So it'll be a pretty straightforward last little run through for those final bones of the skeletal system.